Hi, good evening.
Good evening. Hello, Maarten.
Yes, hello, hello.
So we're the early birds. Oh, there's Giancarlo as well.
Yeah,
Let me just pause. So, good evening, everybody. Welcome to tonight's webinar, which will be presented by HOYA Vision Care. I'm Daniela Nosch. I'm the chair of the Education Committee of the European Academy of Optometry and Optics, and it's my great pleasure to moderate this webinar. We also have Pascal Blaser joining us. He's the medical director myopia for DACH, that is Germany, Austria, and Switzerland, and also the global professional affairs manager for myopia. Good evening, Pascal.
Good evening, Daniela, and good evening to everyone, dear EAO members and dear guests. So yes, welcome in behalf of HOYA Vision Care. I'm really delighted to welcome you to this webinar. As Daniela said, I'm for myopia, but tonight, it's not about myopia. So I'm really pleased and welcome and thanks to the speakers, Giancarlo and Maarten. Thank you for joining and put your effort into this nice topic. Thank you, of course, to all the EAO support, Christina, Daniela, who supported, and of course, Rupal to support us as HOYA to bring education to the EAO and to support for this nice webinar. So to make it quick, because football coming later on, I will give back to you, Daniela. Thank you very much for the moderation and enjoy the evenings.
Thank you,
Bye.
Pascal.
Thank you.
So the topic for tonight is pre-presbyopia, a new category in vision care and identifying the need for early solutions. Well, young presbyopes are dynamic individuals juggling their careers, family life, and a range of daily responsibilities. Yet many begin to notice a decline in near vision, experiencing blurriness, eye strain, and fatigue, particularly after prolonged screen use. And often they go years without adequate correction, leading to discomfort and increased visual effort for even routine tasks. In this webinar, we will explore how modern lifestyle has reshaped our visual demands, the challenges faced by pre-presbyopic patients, and the practical solutions optometrists can offer to support their evolving needs. Before I introduce our speakers, I would like to ask you to keep your microphones off during the presentation. And please do ask questions. You can put them into the chat, and we will hopefully be able to answer them all at the end of the presentation. I'm also happy to inform you that the webinar has been registered with GOC in the UK, so you are eligible for CPD points if you stay for the entire meeting. So let's move on to our wonderful speakers tonight. We have Giancarlo Montani, Professor Giancarlo Montani. He is a professor of the clinical contact lens application at the University of Salento in Italy, and he co-founded the Center for Contact Lens Research of the University of Salento, but he also works in private practice. He's been involved in optometry longer than I can think, since 1988, and is so well known that he hardly really requires an introduction. He has published numerous articles in optometric journals and has been invited as a lecturer to several national and international optometry congresses. We also have Maarten Brouwer. He joined HOYA, the Netherlands, in 2011, having worked as an optometrist and dispensing optician previously for 20 years. He was facilitating training sessions for eye care practitioners and started Dutch HOYA faculty. And Maarten is an expert in solving non-tolerance problems with spectacles. In 2017, Maarten joined the global organization as lens expert and trainer in the marketing and product departments. And since September 2019, Maarten is part of the global education team of HOYA Vision Care. Good evening, Giancarlo and Maarten.
Good evening.
Good evening.
The
Thank you,
stage is
Daniela, for the
yours.
presentation. So,
All right. Well, I didn't know about the football, so let's start quickly then. Thank you for reminding Pascal. Early onset presbyopia affecting individuals aged between 38 and 45 has long been unrecognized phase of vision changes. and overshadowed by its more widely acknowledged counterpart, presbyopia. However, the demand of modern lifestyles, dominated by prolonged screen time, reduced natural visual breaks, and increased multitasking, have led to an earlier onset of visual discomfort and functional challenges. We are aiming in this webinar to redefine presbyopia and advanced focus lenses as a distinct category within vision care, emphasizing the importance of early identification and tailored solutions. So we will have a webinar that's built up in 3 steps. First, we will talk about the insights on the early onset of presbyopic needs, the strategy, how to introduce the advanced focus lenses, and the technical substantiation of those lenses.
So why is pre or young presbyopia considered a new category in vision care?
Well, that's indeed a good question. And for that, we will go to the insights to see and discover how things have changed in the last years. Giancarlo, up to you.
Yeah, I'm here. You can change the slides, please. Okay. So we know very well what is the presbyopia, and it's seem not important to start with the definition. But I think now we have to change some point of view about this condition, because when I started study many years ago, presbyopia was related to a special range of ages and the difficulty to read at normal distances, as for example 40 centimeters. But now we have not this condition very clear, because using the definition from the clear presbyopia from the BCLA, and it is very interesting monography on presbyopia, where this condition was well defined and split in different directions. And the new definition for me is very important for the last part of this sentence, because we can consider presbyopic patient people who are not is not able to see at near distances, but the lifestyle is another condition put inside the distances. The next slide, please. So you can move the slides, please.
Yeah, it's moving, I think. But
okay. Okay, because also lifestyles change or induce early onset of presbyopia. We know very well how the digital devices are common used, and how these devices change our way to see at near distances. But also there are other factors, as for example, visual ergonomic not good, or insufficient breaks, smoke, or poor sleep that contributed to start the presbyopia early compared with the normal age. And considering also the distances is another important point. The next, please. Because as we can see here, we have different devices available, and these different devices are used at different distances. And
oh, we seem to have lost him. Ah, he's coming back.
Okay. It's okay now?
Yeah.
I lost you?
Yeah.
Oh, okay. And so considering also the digital devices, and as we can see here, the internet user are between an age of 16 and 64 years old. And again, if we consider the average distance for user is around 34 centimeter. The next slide, please. And considering this average distance is not the real distance for all people use smartphone, because when we see the picture published in this article from the PLOS One in 2023, we can see how a lot of people using distances shorter than 35 centimeter. And again, this could be another point to increase the near vision symptoms, because the subject has to use a more accommodative response and also more convergence. And this is another interesting point also when we start to do some kind of near examination, because we have to change our point of view also to set the distance. Is not common now using the examination at 40 centimeters, because this is not the real distance, it's an optometric distance. And in this case, when this subject will return back to their style, probably the addition measured at 30 centimeters is not enough for their needs. And again, it's important now to change the point of view and to change also the way to measure the near addition for this subject for several hours by day, smartphone or other kind of digital devices, for example. The other slide, please.
Okay. Yeah, I think I will take over here again. So here we see the amplitude of accommodation related to the age according to Duane. And we can roughly identify 3 different groups. First, the age between 20 and 38. We see there an optimal performance is achieved through adequate accommodative flexibility. And performance is primarily driven by the elasticity of the crystalline lens and the action of the ciliary muscles. Between 20 and 38, this ability is at a high level, and the lens remains sufficient elastic, and the ciliary muscles are robust. Second group, or third group, as you can say, is between 45 and 55 and older. Significant reduction in amplitude of accommodation is seen here, and loss of lens flexibility results in increasing reduction in near vision, requiring increasingly high near add power to be added to the distance RX. And the third group is, let's say, the age between 38 and 47. Starting around age 38, the gradual loss of lens elasticity leads to reduced accommodative performance, highlighted by symptoms of visual fatigue, near-far blur, headaches, and eye strain, and also referred to as the early onset presbyopia. And of course, we all have unique visual needs, and we evolve throughout our life as we get older. So we need different visual solutions to address specifically our visual needs at the different stages of our lives. From 6 to 37, we are myope, hyperope, or ametrope, and require vision correction at one distance with single vision lenses, which means one prescription. In our late 30s, the first symptoms of presbyopia start with a gradual loss of the eye's ability to focus on nearby objects, and it continues to develop as we get older. Hence, consumers' visual needs evolve between myopia, hyperopia, and ametropia to the first symptoms of presbyopia, and wearers gradually need more support at near vision distance, which means that young or early onset presbyopes have special needs that usually fall between that single vision and progressive lens category. So for existing wearers who have just turned presbyopic, common visual problems can include constant switch between wearing and removing of spectacles. When hyperopes and myopes develop presbyopia, they often need to adjust how they use their glasses for near tasks. And myopes often find that removing their glasses allows them to see nearby objects more clearly. as their glasses correct distance vision, but can blur the near objects. This can become inconvenient, especially if they need to constantly switch between wearing and removing their glasses. Blurred near vision. Without the appropriate lenses, early presbyopes may struggle with near tasks like reading using smartphones, which can lead to frustration. And of course, difficulty with lower light conditions. As presbyope progresses, reading of performing close-up tasks in low light conditions can become increasingly difficult, even with the glasses. So these issues often lead spectacle wearers to seek solutions to avoid the hassle of frequent switching between wearing or removing their glasses. In case of non-spectacle wearers who have just turned presbyopic, you see some small differences in their visual problems. Sudden difficulty with near vision. Emmetropes who never needed glasses may be surprised by the sudden difficulty in reading or performing other close-up tasks. As presbyopia gradually reduces, their ability to focus on the near objects is changing. Increased eye strain. As they try to compensate for the loss of near vision, emmetropes may experience eye strain, headaches, or fatigue, especially during prolonged near work, like reading or using the smartphone. And of course, frustration with loss of perfect vision. Emmetropes used to clear vision and post-LASIK patients have enjoyed freedom without spectacles, often feel especially frustrated when presbyopia sets in, undermining their prior clarity.
So what are the main challenges young presbyopes face in today's digital lifestyle?
Well, if we look at that and we see who are those early onset presbyopes and what are they facing, of course, it's the mainly the adults in the 30s up to mid-30s up to the 40s. And what they face is their visual condition. It's myopia, hyperopia, or emmetropia with starting presbyopia, requiring vision correction across different distances. So single vision lenses are not enough. They also have some visual concerns, starting to have difficulties with near vision, near blur, eye strain, discomfort after prolonged time working or reading at near distance. The lifestyle, of course, the lifestyle is also changing constantly. We're busy, multitasking, and frequent users of digital devices. And we should not forget the budget. They're used to single vision price lenses or have never spent on purchasing lenses before. So this is something that could be quite a strong hurdle for them.
And another important thing to consider in this kind of population is the time they need to refocus the images. Because now we spoke about the possibility or to understand which are the challenges related to the different distances. But we have also to consider that now the near vision tasks are not a static condition, but is a dynamic condition. So subject need to change the focus very frequently. And in this article, it was found as increasing the age of this subject, the time needed to obtain an images on focus on the retina increase, and increase also considering the focus. And it's also important to see other things related to this condition. The next slide, please. Because as we can see here, in a focus group, it was found that an average of 333 times per hour are related to change of a focus. And this is very important because we need also the right solution to give this kind of flexibility very easy for the subject. Because this could be another cause of symptoms, maybe not just related to the focus, but related to the eye strain for this kind of population. So the other slide.
Okay. So taking into account this information, we can identify 4 major subjects. First one is the visual performance. Both age groups, the 35 to 40 as the 41 to 45, that Giancarlo showed in the previous slide, show a decreased visual performance with increasing defocus. Response time. Increased response time with defocus indicates delayed visual processing, which can impact daily activities, requiring quick visual decisions. Tasks like driving, reading, and using digital devices may be affected, especially in low contrast condition or poor lighting. And then we have the correction needs. Full correction of refractive error becomes increasingly important to maintain optimal visual performance and response time. So if we look at this, we can call this the early onset presbyopia, and they often settle for less by choosing temporary or less effective solutions, like wearing single vision lenses where they should need something else, buying cheap ready reader's glasses, getting entry-level progressive lenses as their first pair of glasses in a later stage, increasing screen magnification, the font size or brightness of the screen, and of course, constant switch between wearing and removing of the spectacles. So they continue for many years without adequate vision correction.
And again, return back to this kind of subject, because this is a very interesting part, is a bridge between young and presbyopic patients. And this part always is not well managed by the ECPs, because there are not the real solution designed for the management of this spatial range of ages. Because as we can consider, presbyopia is the start of the older ages, and all kind of solution related to the presbyopia are not well accepted by younger or people feel younger. And so we have people following, using so maybe different approaches to see clear, or maybe not so clear, but enough for their aim, but also with symptoms at the end of the day, for example. But I think is a psychological part very important in this range of ages, because it is I remember when I was presbyopic. So presbyopic for me, when I was young, was the last part of the life. And I remember my first patient presbyopic with a very sad condition. But now when you are in that kind of ages, the things are different. And maybe someone don't want to accept this condition, or maybe don't want to use a spectacle, for example, because some kind of information, wrong information, are related to adaptation on a spectacle, for example. And so many people prefer to see not in a perfect way, because they feel that this condition is the best one to start using spectacle later. We know perfectly this is wrong, but we have also to work with this condition too. And speaking about the solution available for this young presbyopic patient, we can consider 3 different levels. For example, we have the digital or anti-fatigue lenses. but we know very well that this kind of lenses were designed for people, for young people, to support the vision in the digital world. And so this is not for presbyopic subject. We have also the entry-level progressive lenses, but again, progressive lenses are designed for real presbyopic subject. And also this kind of solution are solutions not psychologically well accepted by younger people. And we have also the single vision readers. And again, this is, I think, one of most used solution in Italy too, because it's easy, cheap, but is not the right solution to manage in a better way the visual condition. Because when we arrive at the end of this webinar, we speak about anisometropia, and the anisometropia is not an exception, is a rule of refractive condition. And so single vision readers are not the right solution for this kind of subject. So these are the devices or the solution we can use in early presbyopic subject. All of these solutions can improve visual quality, but are not the best solution for patients, because we have to remember that the old kind of design are prepared for a special task. So, for example, when you consider an anti-fatigue lens, these lenses are useful to increase more positive in the lower part of the lens. The intermediate part is not important because a young subject has enough residual accommodation, and so that part is not useful. And speaking about progressive addition lenses, we need that part, the intermediate part, because it's part of the optical condition useful to see at different distances. And this is very important because sometimes we forget which are the idea behind some different design. And I think now we have, thanks to the freeform technologies, many design well designed to consider every needs of presbyopic or non-presbyopic subject. And for us, our aim as ECPs is to understand which is the right solution for every ages and for every kind of task. And so the next, okay.
Thank you. So the adapted solutions should correct their overall vision while supporting the vision at near. And we can say, like Giancarlo already mentioned, existing PEL are currently not adapted to this early onset presbyope. Because different reasons, different design from single vision. It can be a source of discomfort and require some adaptation when switching to progressive lenses. They might feel it's too expensive. It's an important price jump between single vision and progressive lenses. It also is conceived as being for an older target. So the positioning is also different if you look at progressive lenses. But last but not least, a lot of ECPs are reluctant to recommend progressive lenses to early presbyope because of the, let's say, emotional age and budget considerations, risk of underperformance, complaints, and dissatisfaction. And they rather recommend single vision lenses instead. So most early onset presbyopes continue to wear single vision lenses, even though it does not fully correct their vision. And we also can see this in, let's say, some numbers that we get in. So what we get out of our data shows that progressive lenses are almost never recommended to young or early onset presbyopes, as low addition represents only 3% of the volume of the ordering of progressive lenses. So The wide majority of the entry PAL orders are for high editions, meaning for mature presbyopes. So assuming that patients with +2 edition are usually around 55 years of age, it means that patients can spend more than 15 years without an adequate vision correction.
So this is a very important part because again, when we speak about progressive addition lenses, sometimes people have a fear about the non-adaptation. But again, non-adaptation is, I think, an older condition because it's not related to the progressive addition lens design. But as we can see, the majority of non-tolerances are related to the prescription. So prescribe is not a very easy task. It seems easy, but to find the best solution to increase the visual quality and also the comfort sometimes is not very easy. We have not some special rules to follow in this direction. And in this part, we can find part of the causes of non-tolerances. And also we have some problem related to the dispensing. Maybe the wrong design for that kind of lenses, or also wrong measurement to put the lenses in the right position. But I think also, and I think it's very important, the last percentage you, Maarten, told before, 80% start very late to work using progressive lenses. And this is another cause of problem for our presbyopic subject. If you go to the other slides, maybe we can see in a better way what I want to tell. In this case, I have plotted different kind of addition. We have the same design, same lens design, and I measured the non-functional area, so the distortion, considering different addition. And as you can see here, if we start with an addition of 1 diopter, it's easier for subject using the progressive addition lens optic, because the non-functional area are very low as effect. But if we start considering, for example, an addition of 2 diopter, the non-functional area are very high. And for this patient is more difficult to understand the right way to use their new spectacle. So I think now we have to change our point of view, starting as early as possible with multifocal solution.
I think we lost him again.
Yeah, it's freezed.
Ah. Ah. I was going to ask him a question there, but I don't think he can hear me. Can I ask you, Maarten?
Yeah, please do.
How does the VisuPro address the gap between single vision lenses and progressive lenses?
Well, that's exactly the question that we need to answer here. And for that, we have to look more about the strategy part and how we can introduce in these advanced focus lenses. So first of all, we have conducted the market research to understand the unique need of this.
I'm sorry.
Yeah, no problem. No problem.
Okay.
We're happy you're back.
Yeah.
Yeah.
So we want to understand the unique needs of this group of young presbyopes, existing wearers and non-spectacle wearers between the 36 and 44 years of age. And we see the same percentages for existing spectacle wearers and non-wearers when looking at the first two statements that you see in this slide. They want to have the best vision for all activities in daily life, and they are highly interested in lens optimized for the near distance and when using digital devices. But if you look at the second two statements, there are some differences in percentages when we look at those claims between the wearers and non-wearers. So having increasing problems seeing clearly in the near distance and when using digital devices is more prominent in the non-wearers. Same for the experience, that increasingly vision problems in the near distance, but they are reluctant wearing progressive spectacles or spectacles at all if they have the choice. And for that, we also need to know the benefit for those people. And we have, of course, the benefit ranking top 3 for the existing spectacle wearers. And you see that the things they find important is that it prevents from eye strain or visual fatigue when working with screens, offers precise and clear vision for various distances, and suitable for all sorts of daily activities. You would think for the non-spectacle wearers it would be more or less the same, but there are some differences there. So we see, first of all, they are very into natural and seamless vision without distortion because they are coming from, let's say, not wearing spectacles. The second one, prevention from eye strain when working with screens, is, let's say, the number 1 in the top 3 of the spectacle wearers. And of course, what they are looking for and what are also afraid of is instant adaptation when they do not wear their spectacles before. So these are things that we need to take into consideration when thinking about the solutions that we have for as well the wearers as the non-wearers. So with the new solution, we acknowledge the requirement of the early onset presbyopes. And of course, we have the, let's say, single vision or non-spectacle wearers, where you see that that also has been some challenges there. And we have the progressive wearers, and in between, so we try to bridge that gap. And with Visu Pro solution, we really bridge the gap between the single vision and the PAL category to help the early onset presbyopes to specific tasks, especially at near to intermediate distances, but also to offer affordable price positioning between single vision and PAL. By recommending Visu Pro solution, we will also be able to increase the conversion to progressive lenses in the future, especially in the mid-tier range, in order to keep offering a very comfortable and high quality vision for the patients. So in the end, these early onset presbyopes will have a faster and smoother adaptation to PAL, and we will have a long-term competitive advantage by providing Visu Pro today to our patients. So if we look at Visu Pro, it's the name is derived from vision and superior and pro, and it suggests better performance and vision. And we have two versions of the Visu Pro. So the first one is the Visu Pro All Day. So if your vision is not as clear and comfortable as before, you start struggling with reading or close-up task, the Visu Pro All Day lenses are made for you. So they provide precise and clear vision across all distances with unmatched comfort up close when looking at near objects such as digital devices. And they offer natural and effortless vision for your everyday activity in a single pair. And Visu Pro All Day is aiming more for the existing spectacle wearers. The second option is Visu Pro Flex, and they are made to give more comfort, also for the intermediate and near, and they can be worn over the contact lenses or only when needed for near distance activities, and they provide precise, clear vision across all distances with unmatched comfort up close when looking at near objects such as digital devices. And they offer, of course, natural and effortless vision in one single and aesthetic pair of lenses. So how is this lens built and what are the technical substantiation of this lens? So the key technologies. There are 4 technologies embedded in this lens. So we have the focus max optimization. We have binocular harmonization technology, binocular eye model, and individualization. So we will dive a little bit deeper in these technologies. So first of all, the focus max optimization. What you see here is that we have the 2 versions, the VisioPro All Day and the VisioPro Flex, and we have 5 types of focus max power. And the focus max power is positioned at 10 millimeters below the prism reference point, and that's the same for as well the VisioPro All Day as the VisioPro Flex. VisioPro All Day will be available in 3 different versions, the type 1, 3, and 5. And the VisioPro Flex is available in 4 different versions. And what you see here, that we have smaller steps in the power changes, because these lenses are especially for people who do not wear those spectacles at all during the day. So for whom are they available? So if we look at the VisioPro All Day, it's especially existing spectacle wearers who wear glasses throughout the day. And we have those focus max power. And on the right side, you can see a mapping of how the lens is built. And we have then the VisioPro Flex. And this is more for a different target group, wearers who use their spectacles lenses primarily for near distance activities. So more recommended for non-spectacle wearers who tend to wear their glasses for more specific moments and may not want to wear their glasses all day long. And we talk about emmetropes, contact lens wearers, and post-refractive surgery patients. The second technology is binocular harmonization technology.
So when is it important to ensure binocular harmonization between the designs of the 2 eyes?
A good question indeed, and I will leave that to Giancarlo.
So as we can see, the anisometropy is very common in the older population, and we have also to consider which are the possible optical effects correcting the anisometropic subject with the spectacle lenses. And in this case, using a different design for both eyes is the right direction to reduce the possible side effect related to the optical induced differences. The next slide, please. And as we can see here, for example, the number of prescription is very high. It was not so common how many anisometropic subjects are available, because again, in 2022, this global prescription analysis found that 87% of subjects need some differences. And we know also as important the optical position, for example, of the near zone is useful, because when we consider the monofocal correction of anisometropia, we have just to see or to consider the differences in lens magnification, so the anisoconia, or maybe we have to consider different kind of prismatic in convergence. But this is usually under some differences between the lens, not so effective on the quality of vision of our subject. The different things is related to the progressive addition lenses, because as we can see here, the next slide, please. And if you want, Maarten, or I follow, the anisometropia or optical induced effect are related to different accommodation, for example, because different power need a different residual accommodation, prismatic effect in vertical, and also different position of the inset of the lens, because the prismatic effect are different in the lens, in the left and the right lens, and for sure also the magnification. And so I think it's your time, Maarten.
Yes. Thank you. So just to get a little bit deeper into that, when the wearer looks into any direction other than straight ahead, the eyes do not remain on the same level as they should, in case if there is a difference in prescription between the right and the left eye. And it makes the lines of sight unequal, and vision becomes blurred or even double. So as you see on the left side of the slide, looking straight ahead is no problem. Looking up or looking down will change the line of sight between right and the left eye. So if the eyes would have the same rotation towards the reading zone, in case of lenses with a progression, the result will be double vision, or at least blurry vision, because of the different prismatic effects. To make sure the image in the right and left eye are on corresponding retina areas, the eyeball rotation will be different between the right and the left eye. And that's what you see on the right side of the slide. Of course, for single vision, this is not insurmountable, because by changing the head posture of the eyes will find the center of the lens again. But for lenses with a progression, this can give some issues. And just to give you an idea about how much this prismatic effect difference is there. And what you see on this slide is that the prismatic effect appear depending on the power difference between right and left and the length of the corridor. And you can calculate how much difference in prismatic effect there is between the two eyes if you take the vertical difference in prescription and you multiply that with the corridor length in centimeters. So in case of an 0.5 diopter difference in the vertical direction with a corridor length of 40 millimeters, the difference in prismatic effect will be 0.7 prism diopters. If you only go to 0.75 difference with this corridor length, it's already at the 1 prism diopter mark. And as you can see in the calculation at the bottom, when you increase the corridor length, the prism effect difference will be even more because of that. So there is, let's say, the corridor length and the power difference work together on the amount of prismatic effect difference that there will be. So this calculation shows that a shorter corridor can help to keep the unwanted prismatic effect as low as possible. But on the other hand, short corridor also means a decrease of the visual field because of the steep transition of the addition power. Back to you, Giancarlo.
Are we losing him again? Giancarlo?
Okay. Yes, I'm here now. But again, my connection this evening is not good to perform a webinar. I'm sorry for this. And again, as Maarten told, this is a problem in progress. It's important to find the near zone. And so using progressive addition lenses is important, the movement of the eyes, not the same in single vision lenses. And for this, patients can decide to have near vision also, because don't reach the near zone and to stop before the near zone to reduce the vertical imbalance. Because again, in the vertical direction, we have not enough vertical fusional divergences to manage these differences. And so maybe we have a patient not happy about the quality of vision, but not before the addition is not enough, but because he prefers to stay or to move lower the vision axis below, and to stop before the starting near zone. And this is another important for us. As Maarten told, we can use a short corridor, but this increases the non-functional area. And so this is the problem and the balance we have to consider when we prescribe progressive addition lenses with common design or with same design in both lenses in an isometropic subject. And the other slide. Okay, and the other problem is the magnification. Nothing new for you, because we know very well which is the effect of the design of the lens and the position inducing disease of retinal images. But in this case, it's important also to understand what's happened in progressive addition lens wear. Because considering the effect, okay, this is the classical formula about spectacle magnification, when we have one part related to the shape of the lens with the thickness, the refractive index, and the front surface curvature, and in the other part we have the frontal, the power of the lens, and also the distances between the lens and the entrance pupil of the eye. And at this point, the big difference in the behavior, considering the progressive addition lenses. The next slide, please. Because in this example, we have 2 diopter of anisometropia. If we calculate and we use the previous formula, we can find a different magnification between both lenses of 3.5%, because we have 12 millimeter, and we put also the distance between the anterior part of the cornea and indicatively the pupillary entrance, and we obtain this difference. But sometimes it's not so clear what's happened when we use the same lens for near vision. Because, and this is, and I need the next slide, please. In this case, the distance between the lens and the entrance pupil is higher. And as we can see here, the difference between the lens is the same, because we have always 2 diopter of isometropia. But the magnification is much higher, because the distance, when we use the lens in near vision, is higher. Usually using a lens, a progressive addition lens in near vision, we have around 20 millimeter of distance. And for this, we have an increase of magnification. And this is another cause. For example, during the examination, we have not found a particular visual problem, but when we prepare the spectacle with the progressive addition lenses, not well calculated or without an harmonization between the lenses, the increase of difference of magnification in the near zone can increase the symptom for that kind of subject. And this is another important part. And I suggest to check, maybe using some special tests, as for example, the HOYA test, to evaluate the performance of progressive addition lenses in an isometropic subject using the real spectacle. Because in this case, we can measure the real differences between the magnification in both eye. Because if I put also the right addition in the spectacle, or maybe using a phoropter, we have a different distance, and the different distance, considering also the shape of the lens, can induce different kind of magnification. And sometimes these are the conditions where we can find an easy solution for an unhappy subject using progressive addition lenses. Next. And it's important also to remember that the differences between the images that inducing some kind of symptoms is not very high, because it was found that the discrepancy higher than 0.75% are enough to induce symptoms. We know that we have also differences no good for the binocular vision, but this is the higher part. It's important to remember that small differences can be more problematic for subject, because the subject can fuse the two images, but not in a very good way. And this condition can associate it with symptoms during the spectacle wear. Okay. Next slide.
Thank you. So in Visu Pro, we take this all into consideration, and we use the binocular eye model to do that, which is an evaluation program that takes into consideration a few steps already mentioned by Giancarlo. So we are looking at the accommodation demand difference between the right and the left eye, magnification difference between those two eyes, as already explained, and the binocular convergence, but especially also the prismatic effect difference in the vertical direction. And to manage that, we use binocular harmonization technology. So in binocular harmonization technology, we take into account the demand, for example, of the necessary accommodation along the meridian. So what you see, there is a mapping which shows the necessary accommodation chart for Visu Pro Flex in this case. And in this mapping that you see here is it without the binocular harmonization technology. So what you see on the right side, the mapping, is the binocular accommodation difference. The darker the blue or purple, the lower the binocular accommodation difference at that point. On the left, you see of this mapping, you see the necessary accommodation along the meridian chart. And the points on the chart has corresponding points or positions of the adjacent map. On the necessary accommodation chart, you see the blue line representing the accommodation for the right eye, and you see the orange line representing the accommodation for the left eye. at 0 on the chart, which means at far point, this is the corresponding point on the mapping, which is at fitting cross. And at this far vision point, there is no gap between the necessary accommodation between the right and the left eye. And as the eyes move down to the near portion, this is the corresponding point on the mapping and the necessary accommodation along this horizontal red dotted line. You see that at this point of the near portion or reading zone, that there is a gap between the necessary accommodation between the right and the left eye, as you can see in the circle. And this is exactly why we want to achieve, and using binocular harmonization is to improve the accommodation difference between both eyes by reducing this gap. So in the next slide, you will see the VisuPro Flex when binocular harmonization is activated. And especially looking at the necessary accommodation along the meridian chart, you will notice a significant improvement after binocular harmonization is activated. The necessary accommodation between the right and the left eye is now the same, leaving almost no gap or difference in between. So we talked about line of sight already, and what we also saw is that there is a power difference between the right and the left eye, and the eyes move down into the progression of a lens. What happens is that the line of sight changes to still have the corresponding retina fields overlapping. So what happens in that point, and that's what you see on the picture on the top, is that the right eye is moving more down than the left eye in this case. And instead of having the 1.5 addition power needed, the right eye will look through a portion of the lens that will have 1.6 diopters as an addition power, and the left eye will take a spot in the lens which covers 1.28 diopters, which means both eyes will need something different if we look at the accommodation. So what we are doing with binocular harmonization is that we calculate exactly where the line of sight is, and at that point we will also move the addition power needed. So this means that for one eye, the corridor length or the reading zone will be expanded a little bit, and on the other side we are compressing the corridor length in the same number to get, let's say, and match the line of sight of this person.
So what do eye care professionals play? What kind of a role do they play in educating patients about early presbyopia solutions?
Well, they play a crucial role, I would say. So if you look at, let's say, individualization, that means that each patient has distinct vision needs and preferences. So the more information we as a supplier will get in, the more precise we can calculate exactly the line of sight, and also how much we have to balance the two corridor lengths and the addition power for that patient. So lens individualizations optimizes the visual performance and will enhance comfort. And that can be achieved through, of course, the right measurements, good measurement on the refraction, but also measuring the individual wearing parameters as corneal vertex distance, as Giancarlo already mentioned, is a very important part of the calculation. And of course, pentoscopic angle is also part of that. The right frame selection, so that also makes that the frame is in a good position in front of the eyes. And of course, we also have some advice programs that can be used that are patient-centric lens selection tools to get to the right part of that. Next to that, also the patients need to be educated by the ECP. And of course, what they need to know is what are the differences between the different solutions and what are the pros and cons of that different solutions. So they need to be educated about, okay, what can I have or see with my single vision readers compared to, for example, the single vision distance lenses. This is, of course, a solution that does not cover all distances for this patient. What happens if I choose a progressive lens? Is it an entry-level PEL, or do I go to, for example, a mid-tier? That also can be very important for what the expectation of the customer or the patient will be. Then we have, of course, the more specific solutions like VisuPro all day. If you are a spectacle wearer and wearing your glasses all day, this could be a very nice in-between step between the single vision and that progressive lens. Or if you are a non-spectacle wearer, the VisuPro Flex could be the best solution for you, especially for the work that you do on, let's say, intermediate and near distances. And then we get back to this overview, and then we see that we can add one extra category to this overview, next to the digital or anti-fatigue lens, the entry-level progressive lens, and the single vision readers, as Giancarlo already has discussed in the previous slides. We can now add the advanced focus lens, where we look at the design type. It's designed for early onset presbyopes. The target groups is for late 30s to mid 40s with their first presbyopic symptoms. It's for spectacle wearers and non-spectacle wearers experiencing visual discomfort up close. And of course, it's a very good preparation, easy to adapt and support to the conversion of progressive lenses in a later stage of their life. If we look at the prescribing guidelines, of course, in generally, VisuPro lenses should be recommended to people in the late 30s to mid 40s with first presbyopic symptoms. And that you can consider the following to further refine who may benefit the most. We have patients with early signs of eye strain from near work, but whose distance vision is still fine. Patients experiencing difficulties reading the fine print, especially in low light, but not yet require full progressives. Patients who frequently switch between near and far tasks, for example, using a smartphone reading and while driving. Patients hesitant about conventional progressive lenses because of the dramatic shift in progressive visual experience they expect. Patients looking for gradual adaptation and a comfortable introduction of multifocal lenses, helping the adaptation to progressive lenses as their condition evolves. So, and we also have, of course, note that we have the existing digital lens wearers or anti-fatigue lens wearers, and in that case, we also recommend to be prescribed with VisuPro all day. When you come to a, let's say, advice for your patient, there's also the option to use a trial lens set, and we highly recommend for ECPs to use it because you can more or less show right away to your patient what is the effect of the choice that we have made, and you also can give them some option to compare with, let's say, the different versions of the lens, if necessary at that point. Giancarlo, you want to take over here?
So we are in the conclusion, and I think we are out of time because it's now 1938, I think. And so just to summarize, we can tell now that there are a new category of presbyopic subject, not the normal presbyopic subject or the digital presbyopic subject or the lifestyle-induced presbyopic symptoms. And this category is younger than usual presbyopic subject, and they need a special solution because in this case, we need not to use the old solution available for the consolidated presbyopic or for the younger subject. And I think another important part to highlight is related to the management of the anisometropic patients, because we have some of non-tolerances in this kind of population. and using some kind of optical harmonization between the lenses improve the results. And another condition from my point of view is to start as soon as possible with a varifocal lens, or because this is useful to learn in a very easy way the right eye and head movement to obtain the best result from progressive lenses or from an advanced focus lenses. This is my conclusion, but if you want and if you have other point to highlight at the end of this webinar.
Well, I think for sure this is the advanced focus lens is a new category if we look at it in vision care, and has a big potential if you look at it, because the group of people who are in need of a solution and are, let's say, falling in between those two, let's say, existing groups is growing and growing at the moment, which means there's a lot of people we can help using this type of solutions.
Well,
Okay.
thank you so much. I think you've offered so many new clinical pearls for everyday practice, so we can better address our young presbyopes or pre-presbyopes in their challenging new lifestyles in the digital world. I don't see any questions in the chat, but participants are welcome to raise their hand, and then you can perhaps even voice your question if you would like to.
I think there is one question in the Q&A, if I see it like that. And
Why do I not see it? Do you want to read it out then?
Yeah, I want to read it out. I think it's. I think you better can answer this, Giancarlo. And the question is: you mentioned towards the start of the webinar that lifestyle factors can influence presbyopia, such as lack of sleep. Could you elaborate on which lifestyle factors have an impact on presbyopia and why?
So in this case, it's related about the accommodative response. So when you have a lack of sleep, the accommodative response is not so effective as considering the more relaxed or considering people with the right number of hours of sleep. And this is another important condition to consider. Also, smoke was found as possible effect to induce early presbyopic symptoms. And again, this kind of condition must be considered also during the initial question before to start a refractive examination, just to understand what's happened. Also, it's important for us to evaluate the accommodative response in different conditions. For example, if we have to refract a subject suffering of digital eye strain, it's important to evaluate the condition when the subject is quiet, and also when subject finish his or her works in the bad condition for symptoms. And again, it's important also to adapt our kind of examination to the real symptom of our subject. And I would like also to highlight another important point related to the age of presbyopic subject and also early onset presbyopic subject. And the problem is related to the quality of tear film, because sometimes we speak about just the accommodation, or we try to find the solution in more common position. But we have always to remember the importance of tear film, for the quality of vision, and also for the comfort. Because we can use the best optical solution in the world, but if tear film is not well organized, we can't obtain a good results. So we have not to ask the best result on a spectacle when the tear film is unstable. And again, this could be another cause of eye strain of our subject.
Yes, and to add to that is that using digital screens is reducing the blinking frequency,
Absolutely.
which of course is has a big influence on how the lens will perform.
And it really reminds us to carry out comprehensive eye exams.
Exactly.
To look at all aspects of the eye.
Yeah.
Yes, very good point. One person asked if you can offer the slides to the audience. Will that be possible after?
Yeah, I think
there are no problem.
Yeah, most of the slides we can share, so that's no problem.
Great, thank you. So, I think this was an amazing webinar. Thank you so much. Oh, there is another question. Hello, everybody. Is there any rule or logic relation between accommodative response for anisometropia in right and left eye? And what about phoreas and difference in accommodation?
So, okay. Do you want answer or?
Well, please,
Maarten?
please go ahead, Giancarlo. Yeah.
Okay. I read again the question. So if I well understood, the participant asked us about the differences between accommodation and binocular vision in an isometropic subject. Again, when we speak about spectacle correction, we have to consider also some optical effect on the accommodative demands. So I can tell if there are differences from the physiological point of view. I haven't found article about differences between accommodation in the accommodation between eyes in an isometropic subject, but it's sure that using spectacle, the optical effect of lenses induce different accommodative demand, and for this one eye need more accommodation than the fellow one, and this is the point that can be used also by the optical design to improve the harmonization between the eyes. We have not this problem using contact lenses, for example, because if we fit contact lenses, the accommodative response in an isometropic subject too is quite the same. So it's another of the optical problem induced by the distance between the lens and the eye. So this small distance cause many problems, many optical problems to our job, because as we see before, the magnification, also the different optical, the different accommodative demands is another point to consider. And again, this is and okay. I don't know if it's enough as question.
Thank you. I think as we have overrun a little bit, we will come to a close. I would once again thank you very much for this great presentation. Thank you everyone for holding on. It's been a great webinar, and I wish you all, and I hope you find it useful. I wish you all a wonderful evening, and hopefully see you again, and hopefully see you at the next European Academy Conference in Riga in 2026. Thank you so much. Good evening, everybody.
Thank you.
Bye.
Thank you
very much.
Bye.
Thank you.
Bye. Good evening.
Bye.
Good evening.